Warm greetings to all of our participants and distinguished panelists, and of course our moderator, Anna Brixey. My name is Elizabeth Lule. I'm the Executive Director of the Early Childhood Development Action Network, otherwise known as ECDAN. For those of you not familiar with ECDAN, we're a global network of networks. We were established in 2016 during the IMF World Bank Group annual meetings as a global platform to catalyze high-impact collective action, connecting regional partners with civil society and others for young children and their parents, and to make sure that we advocate for high investments in early childhood development, as well as knowledge sharing and connecting and aligning behind common goals. So a warm welcome on behalf of our partners. This morning we have a very interesting session. It's on investing in our future, nurturing human capital. COVID-19 has changed our lives. It has exacerbated inequalities. And today we reached actually a horrific benchmark with 1 million people dead. Our thoughts go to families who have been affected and who have lost their loved ones. We will hear from our partners who will talk about the short-term and long-term impact of COVID-19, especially on young children and on human capital in general. We will hear about the increasing overlapping crises, economic, learning, food insecurity, and so on. Our panelists will talk about that. We will hear about the cost of inaction. We will also hear from the government of Peru on how they have prioritized early childhood development as the foundation for their human capital. And we will also hear about how we are failing on the principle under the Sustainable Development Goals of ensuring that no child is left behind. I would now like to hand over to our moderator, Dr. Hannah Brixey, who is the manager of the Human Capital Initiative, to moderate this session. Thank you, Hannah.
Thank you very much, Elizabeth. Good morning, good afternoon, and good evening to everyone. I'm truly delighted to be here with you in this really what promises to be a very inspiring panel discussion. As Elizabeth mentioned, our objectives will be to discuss the impact that the pandemic has had on young children, discuss the cost of inaction, but importantly also to explore what interventions and what investments has been working and can work for the future to improve the outcomes for young children. Before introducing our distinguished panels, let me share a few remarks from the perspective of the Global Initiative to Human Capital project that I'm managing at the World Bank Group. And based on the research and the work that the World Bank Group and other partners have been doing. So as we know, and as evidence shows, investing in early years is the foundation for human capital. Human capital consists of knowledge, skills, and health that people accumulate throughout their lives and that enable them to realize their potential as productive members of society. And evidence shows that more human capital is associated with higher earnings for people, with higher income for countries, and with stronger cohesion in societies. And evidence also shows that human capital has been a central driver of sustainable growth and poverty reduction. In that context, quality early childhood programs can help children develop the cognitive and social emotional skills that are really increasingly important in the labor market and for the jobs of the future. And these programs are especially important for disadvantaged children. Now, 2 weeks ago, the World Bank has launched the new Human Capital Index, the update. And it shows that a child born today may achieve only 56% of her productive potential. And in many developing countries, this fraction is, in fact, much lower. You know some of the data still, and even before the pandemic, more than 150 million children were stunted due to chronic malnutrition and illness. Only about half of world's children were enrolled in preschool, and in low-income countries, this figure is only 21%. And more than 530 million children worldwide live in countries affected by conflict, violence, and fragility. Now, with the pandemic, the situation has become even much worse for children. Now, how the Human Capital Project as a global initiative fits in. So it is a global effort to protect and invest in people with emphasis on young children. The Human Capital Project involves country governments and partners to promote more and better investments in people. And it seeks to engage the whole society. It works down from the government down to the level of community with the involvement of the civil society and the private sector. It promotes resilient, inclusive, and good quality health and education services. It promotes robust social protection systems that help people overcome extreme poverty and shocks. And it requires a host of other services, including clean water, sanitation, nutritious food, safe environment for children, and so on. Now, in response to the pandemic, the World Bank is working closely with countries to mitigate the immediate impact. And it's providing 160 billion in financial support, and with a lot of emphasis on strengthening service delivery systems to be more resilient and inclusive. So to give you a few examples, the projects are improving financial and digital inclusion. So for example, providing digital cash payments to poor and vulnerable households so that they can better take care and invest in their children. Using both old and new technologies to improve service delivery, such as providing multimodal learning and outreach through internet and radio on TV to reach students and also reach parents of young children. And it is prioritizing investments in the next generation. So a lot of investments, in fact, go into programs for child development, learning, nutrition, water, sanitation, health, and psychosocial services. You may know that the World Bank is, in fact, the world's largest funder for early childhood programs. And we are working very closely with clients, with partners, and with civil society. And as I mentioned in the World Bank project, for successful implementation, very important element is, in fact, to work directly with communities. So in these projects, we are investing across sectors to promote children's holistic development. We are focused on building capacity. So to give you some exciting examples, for example, there's the Early Years Fellowship Program as a global program that recruits promising young professionals to work in their home countries to support early child development. We are now launching a new effort which is called Engaging Policymakers in Early Childhood to promote learning and provide tailored technical assistance to support more and better investment in early childhood. And we are also investing a lot in knowledge and measurement to measure quality and to measure impact. And our work on quality includes a robust knowledge agenda to identify and promote actionable and evidence-based and cost-effective strategies to deliver quality early childhood programs at scale. So this is just a brief introduction and also a little bit of insight into the work of the World Bank. But importantly, in our panel, we will hear insights from the work of many of partners who work closely under the broad umbrella of ECDAN and who will share their perspectives and their experience with us. So let me now introduce our panel. So first, Sanjay Vijaysekera is Director of Program Division in UNICEF, who's joining us from New York. Our second panelist will be Honorable Zoila Cristina Lempen-Lopez, General Director of Public Budget from the Ministry of Economy and Finance from Peru. So she's joining us from Peru, and also with experience from as a director from Ministry of Development and Social Inclusion. Third, Gwen Hines as Executive Director of Global Programs Save the Children, UK. Then Dr. Jerry Behrman, Professor of Economics in University of Pennsylvania, who invested a lot of research in developing countries, especially from the perspective of empirical microeconomics. And finally, Nafisa Babu, Director for Inclusive Education at Light for the World and board member at Global Campaign for Education. And in the first round, I will ask the same question to our panelists, and that is to reflect on the impact of the pandemic, what the impact has been on young children, and what disruptions there have been, and importantly, what you see and what you have already observed as effective ways to adapt and mitigate this impact for the way forward. Now, we will have time also to take questions from all participants, so please use the chat function in WebEx to submit your questions, and we will then come to your questions after the first round. So let me now welcome Sanjay Vijaysekera, Director of Program Division of UNICEF, to share your perspective. Sanjay, the floor is yours.
Hannah, thank you very much for that introduction, and colleagues and ladies and gentlemen, I hope you can hear me. Morning, good afternoon, good evening, depending on where you're joining from. It really is a wonderful pleasure to be here with you for this really important discussion. Just to get into addressing your question, Hannah, I'd really like to share with you today thoughts and reflections around three main issues. First, a little bit about the impact of the pandemic on young children and their families, which all of you, I'm sure, are familiar with. But secondly, also to go a little bit more into UNICEF's response to the pandemic in collaboration with many of you here, with governments and civil society partners, to protect and support young children and their families. And then finally, how best we could work together to protect this generation of young children, because they're the ones who are paying the heaviest price for the crisis that we face right now. So thanks to decades of research across many disciplines, we do now know that the early years are a critical period to build human capital as the brain develops faster than at any other time, and laying the foundation for lifelong learning, health, and well-being. This pandemic is severely affecting young children's physical and mental health, their social and emotional development, safety, access to education, play, recreational activities, and much more, particularly in conflict-affected and fragile settings, but in all contexts. And before the pandemic, we know that over 43% of all children under 5 years of age were at risk of not achieving their development potential. and now that is much higher. And we also know that even the basics and things that we have been doing well on collectively over the last couple of decades are now at risk. So disruptions in health systems, it is estimated, could result in an additional 6,000 children under the age of 5 dying every day over the next 6 months. The unique nature of COVID-19 and the pandemic has also generated a crisis of care and learning, where parents have become the first line responders. Parents are experiencing multiple social and economic stresses which may affect their circumstances and their capacity to provide nurturing care to their young children. Furthermore, previous pandemics and economic crises have resulted in increased numbers of children losing the care of parents. The impact is likely to have far-reaching and long-term consequences and hinder the SDGs. Consequently, strategic investments in early childhood development need to be prioritized within the COVID-19 response, as I mentioned, to protect this generation of young children who are ultimately paying the heaviest price. So as you are working with governments and civil society partners, and many of you here, the pandemic through a number of strategies, we're trying to enhance policy environments, including strengthening social protection systems to respond to the short and long-term socioeconomic impact of the crisis. This includes expanding family-friendly policies such as paid parental and sick leave, flexible working arrangements, quality childcare. We're also supporting and empowering parents and caregivers to provide nurturing care to young children, including safe, hygienic, and healthy environments, as well as opportunities for quality learning, including stimulation and play. For example, in Bhutan, in collaboration with ministries of education and health and civil society partners, we're supporting home-based learning and preventive measures by developing and distributing animated videos, learning materials and hygiene kits, and constructing water, sanitation, and hygiene facilities in early childhood development centers. Using mass media and innovative mechanisms, we're disseminating timely and contextually relevant information to support parents and communities, including social media, radio, television, community outreach, and online platforms, such as the UNICEF Parenting Hub and the Internet of Good Things. So for example, in Jamaica, a national parent mentorship program has been adapted and delivered through parenting support helplines and public-private partnerships. In Zambia, in collaboration with the government, social media posts, radio and television spots, and billboard posters conveying key messages on responsive care and parenting were developed based on local proverbs and produced in 7 languages to maximize reach. We're also supporting efforts to put in place key prevention measures and ensure continuity of health, education, and protection services for young children and their families, while also caring for parents and caregivers' physical and mental health, which is a prerequisite for achieving good, strong child development. For example, in Serbia, in collaboration with the Ministry of Health, telehealth platforms are being used to deliver home visits to 3,000 vulnerable families focused on helping parents cope and manage stress and provide nurturing care to their young children. We continue to engage in strong advocacy efforts to protect and sustain early childhood development investments in an environment of financial constraints. So for example, in partnership with the ECDAN network, we're testing a new cost of inaction methodology in Bulgaria and Madagascar to protect investments in early childhood. In addition, in 5 countries, Bosnia, Fiji, Kazakhstan, Mongolia, and Morocco, we're working with UN partners within the Joint SDG Fund on identifying and aligning financing for ECD investments within the framework of national budgets. So in order to protect this generation of young children and drive inclusive economic recovery, we need to continue working across 6 key actions. First, to prioritize the continuity of services for young children and their families with a particular focus on equity of access. Examples of these services include childcare, preschool, nutrition, immunization, maternal and newborn care, and community-based child protection. Secondly, provide practical support to parents and caregivers on how to protect themselves from the virus and talk about the epidemic with their young children, how to manage their own mental health and the mental health of their children, and how to support their children's learning and social and emotional development. Thirdly, we need to advocate for continued economic support to parents through the right kinds of social protection measures. Fourthly, we need to support the relevant, contextually relevant innovation and use of technology while gathering evidence of their effectiveness. Fifth, we need to protect and enhance public and innovative financing on early childhood development, evidence-based advocacy strategies and coalitions of support at national and subnational levels. And we look forward to working with many of you on this. And sixth, we reaffirm commitments to human rights and the rights of children that are being undermined during this global crisis. So to conclude, we would like to highlight our appreciation of governments and civil society partners who are leading the way in supporting young children and their families during this global pandemic. We look forward to continued collaboration to tackle immediate and long-term recovery needs and address inequalities to ensure that all young children and their families survive and thrive, laying the foundation for a more peaceful, inclusive, and prosperous world. Thank you very much. Back to you, Hannah.
Sanjay, thank you so much for your inspiring and very informative remarks. And I was especially struck by the many examples you have provided how UNICEF is working closely with partners and with governments and trying to engage holistically to support young children and households within also the context of national strategies and national budget. And I felt your emphasis on prevention and on continuity of essential services is truly crucial, as well as the emphasis on communication, because information, having relevant information is something that has been proven as truly critical for societies as a whole, but especially for parents of young children. And finally, your emphasis on the government budget, on public financing to play its role for young children. And on this note, let's now turn to the Honorable Zoila Cristina Lempen-Lopez, who is Director General of Public Budget at the Ministry of Economy and Finance of Peru, to share her experience. Zoila, the floor is yours. We can see the slide, we cannot hear. Maybe we need to unmute. We still cannot hear.
Hello, could you hear me?
Yes, now we can hear you.
Great. Thank you very much for inviting me to share with you the experience we have in Peru investing in early childhood development. Could you please go to the next slide? Thank you. Well, it's already known that investing in early childhood has high returns, and compared to investing in later in life, every dollar, we could say every sol in Peru invested in children has much more returns. That's why we put a lot of effort in improving the quality of investment we have in early childhood development. Next slide, please. Given this priority, Peru has increased the budget allocated in early childhood development, but we still are working in some results that are important for us. For example, we keep working in terms of newborn health, results such as low birth weight and premature birth. Those results, as you can see in the chart, those are still in the same level or, for example, are increasing. And also in terms of anemia, we spend much more part of the budget in fighting anemia, but anemia prevalence remained over 40% in the last 5 years. So we keep working on these kind of indicators that are important for important results in Peru. Next, please. So what was our response? We worked to build a result-based budgeting program for early childhood development. In this case, we work. In this case, we've worked with the Ministry of Social Development, and in coordination with the Ministry of Economy, we've created this result-based budgeting program. Next, please. The Early Childhood Development Program, it has 3 main groups of intervention. The first one was related to the results we've looked for in terms of maternal health. The second one is focused on the first 24 months of life. In this group of interventions, we have, for example, access to identity, we have access to vaccination, iron supplementation, and home visiting programs. And also we have a third group of intervention that is focused on initial education. Next, please. So we had an important challenge in this context of emergency. All the health facilities were conditioned to attend the COVID cases we still have here. So in parallel, we had to work in securing the provision of basic package of services within this program. For example, some interventions we have to expand were the home visiting programs, and we work into securing the provision of these services like vaccination or iron supplementation by expanding the social programs we have as channels, as alternative channels to keep giving this or providing these interventions. For example, here in Peru, we have a program, a home visiting program that is called Cuna Más, and also we have a social program that is a conditional cash transfer that is called Juntos, and we had to work with the expansion of both programs during this emergency. Through these programs, working and providing these services. So we allocated more budget to expand these programs to be able to reach more people and more children inside their homes. Next, please. Also, we already sent the national budget law for next year, and we are allocating more resources to both programs, the conditional cash transfer and the home visiting program for next year, to expand the beneficiaries in both programs, concentrated in families with children that are 24 months or old or less. And we had increased the budget for Juntos in 2021, and for Cuna Más, the home visiting programs, also for 2021. Next, please. Also, in terms of securing the provisions of the provision of initial education, given that, for example, we cannot, children are not going to the school in these months, we have developed TV programs with initial education every day for children less than 3 years old. Next, please. Another important intervention is we've developed cash transfers for the families during this pandemic. We in Peru, we are about 11 million families with these cash transfers. These are unconditional cash transfer. We have reached almost or more than 8 million families with this conditional cash transfer. Next, please. In the budget law we passed for next year, we've allocated the budget in 5 priorities. This is education, especially focused on closing the digital gap we have in education. If we are thinking that next year maybe we are going to still have these distance programs in education, we also have allocated in our second priority, there is health, including health, improving health indicators in early childhood development. Also, we have poverty alleviation, the economic recovery, and reduction of gender violence. Those are our 5 priorities, and in all of them, we have a special focus on families with children. Next, please. In our ECD budget program, we have created this program recently. This was approved in December 2019. And for this year and the next year, we are working on, even that, knowing that we are going to have much less resources given this, the reduction of economic activity this year, even though we are trying to keep and even improve or increase the budget we are allocating in early childhood development for next year. Next, please. Well, those were the inputs I wanted to share with you. Thank you very much.
Thank you so much, Zoila. This has been truly excellent. It's Peru is such a fantastic example of a country that is prioritizing early childhood development within the budget, even as the fiscal space declines. And it has been truly very interesting, the examples you've provided in the sense of how the results-based budgeting can help identify priority expenditures, priority investments in early child development. And I appreciate the span of programs that you described that go across essential services to important issues such as ID for children. And you also provided very nice illustrations of the alternative channels that the government has established to reach all children, all households through messages, through TV programs, videos, as well as cash transfers. So thank you so much for this wonderful presentation. I'm sure we will receive questions through the chat function, which is open now. So please don't hesitate to submit your questions, comments, through the chat function. Let me now turn to Gwen Hines, Executive Director of Global Programs, Save the Children. Gwen, the floor is yours.
Thank you so much, Hannah. I'm delighted to be here today, and thank you. Just get a few slides to try and prompt a bit of a discussion for you. So I very much agree with what previous speakers have said, and to give more time for discussion, I won't repeat that. But I do want to stress that the education emergency is still hidden. If you talk to many people who are not focused on education, they still see COVID as a health crisis, possibly also as an economic crisis, and it's both of those, but it is also an education crisis. We had 1.6 billion children out of school for the first time in history. And if we don't get it right over the next few months, 10 million of those children will never go back. And that's against a backdrop where we didn't have enough children in school already, particularly children from poor backgrounds, marginalized groups, those with disabilities. So it's on all of us to make sure that we deal with this properly. The next slide, please. Sorry, if you could go back one. Thank you. So this is just the front page of a report that we've put out to Save the Children, and we hope it'll serve as a useful resource for everybody. It brings together the key arguments why education is so important and also what's happening. It builds on surveys we've taken around the world. We've surveyed 25,000 children and their families all the way around the world, and we're also building on the ongoing programs, interventions, partnerships we have in 120 countries around the world. So we hope it'll be helpful to all of you in making the case why education is so important. And obviously it's not just the learning, but it's all the other things that go with it, from the support that children get if they come from difficult backgrounds, to nutrition, the psychosocial support they get, and obviously the challenge on carers. And I know I've had 2 teenagers at home during lockdown for 6 months. I know how tough it's been for me, but just imagine how hard it is for many other people around the world. And so it's very important that we think about those different dimensions. We think child marriages could go up 10 million as a result of girls who aren't going back to school, whose families take the hard decision to marry them off because of that. Again, as I say, it's the poorest and most deprived who really struggle. So I hope this report will be useful to everybody, and we'll put the link up in the chat box for you. Next slide, please. So again, just building on the theme others have said, that you can learn despite COVID. And again, when I talk to people not in the education sector, they feel like there's nothing you can do. Lockdown is lockdown. You have to wait till it's ended before you get back to learning. But that's not true. And you've already heard from colleagues some examples. Just to add a few from our own experience to Save the Children, we do a lot of work normally on education in emergency, so refugee camps, humanitarian situations. So we've really built on that to see what's possible. So in places like Kosovo, we're distributing educational packages to children and their families in very rural areas. In somewhere like Uganda, we're working with what we call child-friendly spaces, which are spaces for children to learn, but also to play and to get mental health support if they need it. And trying to make that fun to learn as well. We've adapted it, so we have the children coming in shifts so they can be safely distanced during COVID. But we feel this is still really, really important. One of the most innovative programs that we all love is the Camel Libraries in the Somalia area of Ethiopia, started 10 years ago. Those are still going strong, 21 camels who take books around to very, very remote areas, and that serves 22,000 children. So a really important contribution, which is something that has survived long term and been very self-sufficient. In Bangladesh, again, we've integrated psychosocial support because children are struggling with this crisis. They don't know what to expect, so much uncertainty. Their families are finding it hard, and the surveys we've done show that violence has gone up a lot in families. We have proven approaches like parenting without violence that we can share with people, encourage people to do, and we're also using things like interactive telephone messages to support. But it's very much an approach like others are talking about, which is children, their families and caregivers, the teachers, because of course they want to also do what they can, governments, local communities. It has to be something where we all come together. And again, we bring in those integrated approaches. Something we've also worked on at Save the Children with UNICEF through the Education Cluster System for Emergencies is the Safe Back to School Guide, which talks about the importance of water sanitation, because of course hand washing is so critical as well. So my message is there's much more we can do even during lockdown, but of course we must be ready to help children get back to school as soon as possible and learn. And just to give you again a couple of statistics from what we've seen, 90% of children we've spoken to said they learned little or nothing during lockdown. That isn't good enough. It's already been at least 6 months and many, many more months around the world, and it looks like it's going to continue for some time. We've also got 37% of people we surveyed in countries who said there's no sign of a date when schools will get back, so we need these adapted ways of working. And lastly, even when we do get back to learning, we need to make sure we're building back better. Too many children with disabilities from poor communities weren't in school. Two children who were in school weren't learning enough. So I'm delighted that we're joining up with UNICEF of two of the biggest children's agencies to really focus on helping make sure children get the most out of school, foundational literacy, numeracy, and this is even more important when parents are facing tough choices to send their kids to school. The next slide, please. This is just to put a child's face on the picture. And it's something I try to focus on. There's too much focus on saying, we'll get to this later, we'll get to this later. We can't do this. The whole focus of the education emergency work we've all been doing for the last few years has been that we cannot wait for children to get learning, to get their development. And you've heard from other speakers, the first 5 years are the most critical for children. They can't wait for us to sort the COVID emergency. We need to be helping them in the meantime. And when we've interviewed children around refugee camps in the world, they say to us that education is one of the things that matters most to them. So it's on all of us to help them to do that. Next slide, please. So these are just some highlights for you to take away. So the new analysis in the report is 10 million children could be out of school forever. And this is the challenge we want all of us to take on. It's something we're taking on to Save the Children, to make sure every child we were supporting to learn before the crisis gets back to school. But of course, we want to do so much more. We've targeted our approach on where it's most needed as part of our overall COVID response, which looks at health, education, social protection, and also child protection. There are 12 countries who pointed on our report are particularly vulnerable and need the most support to make sure this doesn't become a permanent crisis. And also we're focusing on the need to finance this. As others of speakers have said, there's so much governments can do, and Peru is a fantastic example there, but it's something the whole international community also needs to come together to support. And just to underline that point on the next slide. Thank you. So our plan is do a proper plan, which really focuses on how do we get children back learning, be it preschool, in school, so that this isn't a lost generation, but also commit to increase funding from domestic and international resources. And we've made some specific examples here for the World Bank and the IMF, because we should be heading into the physical annual meetings. It's virtual this year, but we hope we'll focus minds. That includes both mobilizing funding, but also working on debt service. People have spoken before, and Peru's case shows the importance of things like social protection. These are expensive for governments, but they are a fantastic investment now and into the future. And my final slide is just to give you a sense of the debt burden that many countries face. And this slide shows the scale of spending on debt compared to the spending on primary education in many countries, and why debt service is something we're focusing on. It may seem slightly strange to focus on this in an education presentation, but I think it's really important to have that overall financial picture so that we appreciate how hard it is to raise the money, but also how important it is. So I'll stop there. Thank you, Hannah.
Thank you so much, Gwen, for making a truly powerful case for investing in young children now. and making the case to governments, to international financial institutions, and in fact the whole societies. And I very much appreciate also the examples you have provided, how we can work together and around the lockdowns, and how much already is being accomplished to reach parents and children. So your examples really illustrate very nicely what is being done and complement some of the excellent examples shared by UNICEF and the government of Peru. Now, let me, for everyone who is connected, let me remind you that the chat function is open, and we will welcome your comments, your questions. And also in the chat, when you open the chat, you in fact can find links to reports that are being mentioned. So for example, the report that Gwen talked about by Save the Children is available. The link is available in the chat. And similarly, reports by UNICEF and by the World Bank and others that have been mentioned during this discussion are being available through the chat. So do open the chat, have a look at what's the resources that are appearing there, and submit your questions and comments. Let me now turn to Dr. Jair Berman, Professor of Economics from University of Pennsylvania, to share insights from research. Jair, the floor is yours.
Thank you very much, Anna, and thank you all for including me in this important session. I'm speaking on behalf of my two colleagues as well, Florencia Lopez Vu at the Inter-American Development Bank and Claudia Vasquez at the Universidad de Buenos Aires. And this talk's a little different. What I'm doing is basically describing a tool we developed for the cost of inaction. We all know well that there's hundreds of millions of children at risk. What this tool is designed to do is to give some crude order of magnitude estimates of what are the benefits that are lost if we don't invest in children today. We're focusing on preschool children. What are the benefits that are lost in terms of their productivity or income over their lifetimes? These benefits depend on benefit cost ratios, and also, importantly, the number of children at risk. We have in mind a life cycle framework, such as is on the screen, where there's early childhood risk. There's various kinds of interventions that may affect those risks and affect outcomes in early life, but not only in early life, but importantly throughout the life cycle, and eventually have important implications for productivities when these children become adults. We have made some estimates that were presented in 2017 in Lancet about what the cost of inaction is. I'm going to summarize on a couple of slides. First, the cost of inaction of not reducing stunting to 15% in a set of countries which have high prevalence of undernutrition. And sort of most important in some sense is the column on the right, which gives the percentage of GDP that is lost by the failure to move from current stunting levels to levels of 15%. And the rows that are highlighted in yellow are cases in which these losses are greater than the total governmental expenditures on health in these countries. These losses can be enormous, more than 10% in the case of Tanzania and Madagascar. very high in a number of other countries. Similarly, here are some estimates for the cost of inaction of not increasing home visits for the first 2 to 3 years of life, or preschool programs in the next 2 years, up to 100% in a set of 5 Latin American countries for which we had the necessary data. These are still important and significant, not as large as the ones for stunning, but in the case of Guatemala, for example, not including preschool enrollments up to 100%, has a cost of 3.6% of GDP, and that's greater than the total governmental expenditure on education of 3.2%. More recently, we've applied this tool to losses from the COVID-19 pandemic. And as been reflected in previous comments, there's huge preschool closures. We have used a tool, which I will describe a bit more in a moment, to estimate the losses for 140 countries in all income groups. And the median loss of a 6-month cut in participation for these countries is 2.8% of GDP. This is just participation in preschool programs. This is additional to the very large losses in education that Glenn was referring to in the previous presentation. Most of those estimates focus on primary, secondary schooling. This is pre-primary programs alone. And you can see these are, in percentage terms, very large losses. And here is a summary by various World Bank country groups of what these losses are for closures of 12, 6, and 3 months. Of course, many countries have already had more than 3 months closures, and it appears far too many will end up with 12-month closures. For 12-month closures, for example, for lower middle income countries, the estimates are over 5% of gross domestic product. For upper middle income, almost 7%. They're lower for low income. Why is that? Because the losses depend, or our estimate of the losses, are what happens with children who otherwise would have been in preschool, do not go to preschool. And since the participation rates on average in low-income countries are much lower, the losses for this reason, and this is only one cause of losses due to the pandemic, are less in the low-income countries. We are developing with ECDAN a tool for the cost of inaction. We will have ready very soon, we're sort of on the beta version now, a user-friendly website that anyone can access. And in this website, the user will provide some key parameters for the country of interest. We have default parameters if information just isn't available for a particular country. And one can easily explore the sensitivity of the estimates of the cost of inaction to alternative parameters. For example, if one's looking at a country that has currently 40% participation in pre-primary programs, what would happen if one were to move to 60% or to 90% or to 100%? What would happen if future labor markets vary in different ways? And this is a project which we say we're almost ready for public launching. It's being pilot tested in Brazil and, as Sanjay mentioned, in several countries with the cooperation of UNICEF. There's references to various studies. So thank you very much for your attention.
Thank you so much, Jerry. You provided a really fantastic illustration how what you call from science to scale, how evidence-based analysis can serve to make the case for investing in young children even stronger. And I especially appreciate your illustrations that the cost of inaction truly is putting a whole generation of young children at risk. And it threatens children's rights, it threatens their well-being, and it threatens their future productivity. And estimates you provided are truly enormous. And it's good to know that the ECDAN website will soon make the tool to calculate the cost of inaction available, and that it will be user-friendly so that governments and civil society can use these tools for advocacy and communication and for policy debate. So thank you so much. Now let me turn to our final speaker, and that's Nafisa Babu, Director for Inclusive Education, Light for the World, and board member of Global Campaign for Education. Nafisa.
Good day, everybody. Let me start by telling you a story of Johnson. He's the boy in the picture over there. He was born a twin in Dondo, Mozambique in 2008 by C-section due to complications. Weeks after he was discharged, his father noticed that he wasn't moving his arms and legs like his twin brother and consulted the doctor at the nearby clinic. The doctor explained that due to oxygen loss to the brain during the delivery process, this has caused him to have cerebral palsy, and they suggested that he sees a physiotherapist in the main hospital in the province, and that was the only physio in their province. Because Johnson's father had lost his job and the urgency was never really explained to him, the visit to the hospital was always put off for years and years, and they also didn't have any money for transportation. So about nearly 10 years later, Johnson was discovered by a community-based rehabilitation worker of Light for the World, and they provided him with a wheelchair and gave his parents some tips to promote his development and inclusion in the family. So while Johnson really has a very loving and supportive family, the poverty and the lack of appropriate advice and support early in life has denied him the rights that his brother has enjoyed, making it harder for him to achieve his full potential. Next slide. So the reality is that still today, many children at risk of developmental delays and born with disabilities, particularly in sub-Saharan Africa, are denied the right to life-transforming inclusive early child development. So sub-Saharan Africa has the highest prevalence of children at risk of not achieving their development potential. And this number is set to increase as a result of the socioeconomic, physical and mental health consequences related to the COVID pandemic, which is felt even more by families of children with disabilities who are usually the poorest of the poor and single moms. And I'll also let you know that in sub-Saharan Africa, the number of children under 5 with developmental disabilities has also increased by 70%. To an astounding figure of 14.7 million since 2016. And this number is probably likely to increase as many children are not receiving the disability preventing vaccinations due to the pandemic lockdown. So let me now move on to talk to you about a study that we started prior to the pandemic. We wanted to track to what extent donors, some of the leading donors to ECD, are being inclusive and also see to what extent their contributions have made a difference in the lives of children with disabilities in 4 African countries: Zambia, Zimbabwe, Mozambique, and Burkina Faso. So I'm going to share today some of the findings of this study. And they are not surprising, but still shocking. Next slide. So early childhood development is massively underfunded despite verbal commitments and overwhelming evidence of its transformative powers. Vulnerable children, particularly children at risk of developmental delays and disabilities, are still being left out, and investments are nowhere near what is required to ensure integrated, inclusive ECD for all that ensures that children do not just survive, but thrive. So what is the status of investment in ECD as an integrated, multi-sectoral approach to the most vulnerable? Next slide. So 9 donors collectively spend about 8% of their total ODA on early child development and ECD. This figure drops to about 2.8 when you take out the contribution of UNICEF. Donors such as France, Germany, EU, and Belgium spend about 1%, while the remaining donors hover around 4 to 5%. Except for UNICEF and the World Bank, most development assistance programs do not track commitments towards, are not actively working towards supporting integrated early childhood development that focuses on disability inclusion. When it comes to inclusive early education and pre-primary, that's the next slide. UNICEF spends about 8.7%, while the GPA about 5% of their budget on pre-primary education. For donors, UK, EU, Germany, France spend less than 1% of their total budget on early child education, and disability inclusion is not really a priority. However, there is some cause for optimism that the World Bank has made the commitment to make all programs disability inclusive by 2025, so that's quite promising, as well as UK, USAID have also made some really bold commitments towards disability inclusion in the coming years. Slide 7. So the picture in recipient countries that we looked at is shows that we're even further away from making a step change in the lives of children with disabilities and the most vulnerable. Basically, health investments were more focused on survival, on child survival, disease control, and nutrition programs were kind of neglected. None of the 4 countries had a fully developed and implemented multi-sectoral early childhood development policy and strategy. And often early childhood development was misunderstood as pre-primary. So early childhood intervention programs and focusing on developing a workforce that is close to communities was often neglected. In countries like Burkina Faso and Mozambique, which I also found very shocking, is that the investment to pre-primary education was around 0.2%. So we have 5 policy recommendations for donors. That's in the next slide. Donors really need to invest more and focus on calculating the real funding gaps at country level for implementing inclusive early childhood development, and particularly focusing on workforce development. There also needs to be an agreed upon method to track ODA spending on early childhood development, and make sure that, and we also need to encourage the use of the disability marker and other markers that can isolate spending on vulnerable groups. There are countries like Austria, Finland, and the EU that have, and the UK that have already started using the disability marker, and at the moment it's voluntary. We also need to increase, donors also need to increase investment to early childhood intervention programs and parenting programs for children 0 to 3 years old, because we are finding children with disabilities far too late, past that critical period of development. And focusing on parenting programs at community level and using some innovations such as mobile technology is even more crucial during this COVID time. Leave no one behind from the outset is very important. So we're asking donors to hardwire inclusion into all their programs and to improve the collection of data. We also need to show leadership and champion ECD as a development priority in their own agencies or in countries. And I think the World Bank is doing quite well in that regard. Next slide. Here are some of the recommendations to scale up early childhood development in recipient countries. And I also really enjoyed Jerry's presentation and their new model of the cost of inaction. I think will be quite useful here moving forward. So donors have to develop a framework of donor investment via a coherent, inclusive, multi-sectoral ECD strategy and embed it within relevant sectors. You know, for delivering early child development programs can be quite complex because you need different sectors to collaborate. So to improve this collaboration, it's important to look at sector leads based on pre-existing and well-functioning donor groups and service delivery platforms. As civil society, we also have a very important role to play to demonstrate the value of inclusive early childhood development programs and to raise awareness in order to increase demand from parents and the communities and other stakeholders. So I think people don't really understand the life-transforming effects that it actually has. Within recipient countries, donors also should give more and support domestic financing for leveraging funds for others, and that includes innovative financing and supporting progressive taxation. I'd also like to add my support to the point that Gwyn made from Save the Children about reducing deaf and writing off deaf countries. We also need to use ODA to build early child development systems that have equity and inclusion at its heart and support the development of cadres of ECD workers. Last slide. So in conclusion, we need your help to amplify the call for increased investment in inclusive early child development. Without urgent prioritization of early child development by governments, donors, and communities, the effects of the COVID-19 pandemic will linger for decades and potentially undo some of the hard-won gains made in the century, and particularly for children with disabilities. Thank you.
Thank you so much, Nafisa, for your excellent presentation, illustrating how underfunded and, in fact, still misunderstood early childhood development is, and the analysis you provided in terms of the gaps that often remain after even after the interventions by governments and donors. Analysis was very revealing. And you made a very strong case for ECD investment to be holistic. So not just discrete individual programs, but truly holistic engagement to address all the needs of young children. And you also provided some very good recommendations and illustrated the effort to calculate the funding gaps, to track spending, and really encourage governments and donors and partners to spend more on early childhood and importantly, of course, inclusion, so that no child is behind. So thank you very much. Now, we are receiving questions and comments through the chat function. This is excellent. We will come to these questions. But before we go to these questions, I would like one question to ask Zoila. Since Zoila, you made a very nice illustration that in Peru, the government being committed to early child development, having a holistic strategy, truly understanding the theory of change as it became clear from the way you described the way the results-based budgeting is addressing the constraints to early child development. So, and there are the resources in the budget. So I'm wondering, Zoila, if you could share with us what the challenges are that the government is facing in trying to really advance early childhood development, and to what extent civil societies or other players are proving useful partners in the effort, and if you could give us some illustration.
Thank you very much for that question. Actually, I would say that one of the major challenges we have in providing the services and the effective interventions we have allocated the budget for in terms of early childhood development is during this pandemic, for example, all our health staff is of course, focused on attending the COVID cases we have we still have here. It was particularly difficult for us to overcome the number of cases we had here in Peru. So it was very difficult for us to keep providing the interventions let's say, in terms of health, for example, vaccination or iron supplementation. We've been working a lot on those interventions for the last years. But during this year, I think one of the major challenges was to keep the level of coverage of those interventions. So, of course, we had to work with the social community. We have been working with local governments and providing home visitings and hiring people of the community to visit families with children, to remind them to keep going to the, for example, to the early controls or checkups for children. We've been working with at least half of the local governments here in Peru to hire these promoters of early interventions for children.
Thank you very much, Zoila, for this illustration of the amazing work that is happening on the ground in Peru. Now let me turn to Manik to share questions. I would say, Manik, maybe 3-4 questions that we have received through the chat function from the floor, and we will turn to our panelists for responses. Manik?
Thanks, Hannah. So we have one question, Hannah, that says, ECD should not only be left to educators in schools. Capacity of parents should also be built. And how is parents' capacity building integrated into ECD programmings? And I guess in the context of COVID, that will be quite significant. Another question is directed to Dr. Berman, where, the cost of inaction is valid and quite important. The negative impacts of COVID are evident, but some reflections at what potential solutions could be given the work he's been doing. And finally, a third question is from Jennifer, where she asks, how are ECD investments and programs helping to identify and support children with disabilities to ensure inclusive ECD education and support throughout life? Because we know that children with disabilities are especially left out in the midst of COVID-19.
Thank you so much, Manik. So let's turn to our panelists. Let me start with Sanjay. To address all 3 questions are critical, and obviously UNICEF has a lot of experience in all 3 areas. So Sanjay?
Thank you for that. I don't know if I have answers to all of them. I mean, I think in terms of the solutions, it is important that we do have solutions, and particularly around difficult issues. I mean, none of these issues are easy. So around continuity of services, as well as things like the safe reopening of schools, it is important that we have both the kind of our messaging is nuanced, but also that we do come up with solutions. And that's why at UNICEF, working with our partners, including many of you here, as well as WHO and so on, we do provide very strong guidance. For example, on maintaining child immunization and how you can do that safely in a COVID environment. Similarly, working with UNESCO, WHO, and the World Bank on a framework for reopening schools. Again, setting clear parameters on when it is safe to reopen schools, and then how that can be done safely, including making sure that both children and teachers are safe, and proper infection prevention and control is managed, access to hand washing and so on. So these are things where you get down into the pragmatic solutions, and there are solutions, because as I think Gwen in her excellent presentation mentioned, this is not about just waiting this out. We are going to have to find solutions that we have to implement in the meantime, and perhaps even with the use of the new types of tools and technologies that we now have at our disposal and have learned to use or have been forced to use, maybe even reimagine things better. So children can learn. We know even better now, both at school and at home, and how we use tools to reinforce both the learning in school back at home. So again, I think there's a lot in the detail of what we call the programming guidance in terms of how to do this. Depends on different contexts and the different areas of work. But I think the important thing is that we collectively we do have some of these solutions so that we can advise countries and governments what to do and how to handle these difficult situations. If I may, just very quickly, if I can say a little bit around particularly the context of conflict, and because we were talking about inequalities and children left behind. So particularly uprooted families and those living in conflict have particularly high levels of stress due to the pandemic, and millions of children are growing up in environments that are conducive to toxic stress. And I think therefore it's paramount that we maintain and further invest in quality and inclusive programs and services for these families and young children. And we do have examples, for example, from Jordan, where we're working with, again, partners and the government, setting up community-based WhatsApp groups for thousands of parents, aided by ECD facilitators to support Syrian refugees. And there are many such examples, because at the end of the day, ECD services are it's a cost-effective and sustainable way to empower families and communities and to interrupt cycles of poverty and violence, and build greater resilience in our societies, which, as we have seen, is very important. So let me stop there, but thank you very much for your question.
Thank you so much, Sanjay. Let me turn to Gwen, who also has been providing comments, in fact, through chat. So Gwen, your reflection on these questions.
Thanks very much. Sorry, just trying to find my mute button. So, I mean, I completely agree with what Sanjay is saying on those comments. And I think the reality is we're all still learning how to do some of these things. I mean, the challenges which we face on COVID are unprecedented, but the more we can bring experiences from the work we all do in places like refugee camps, very remote areas, conflict zones, fragile states, actually those things are in incredibly high demand at the moment. I mean, I spent 3 years, I had the privilege to work in Malawi as country director for DFID at the time. And I remember working with the Ministry of Education to try and work on early childhood development and primary education. And at the time, classes, even where there were classrooms, were 200 kids. It was incredibly challenging for teachers and children. And so then when you tried to talk about inclusion of children with physical disabilities, people tended to say, it's just too hard, it's too difficult, we'll get to it. And of course, if you stick to that business model, it is too hard. It's very difficult, but we need new innovative solutions. And I think that's one of the plus points I hope will come out of COVID, of new ways of doing things. I'm not talking internet high bandwidth solutions in remote areas. I mean, that doesn't exist. But what we have seen is interactive radio programs. Again, some developed in Sierra Leone off the back of Ebola, and now being rolled out more widely. In Malawi, we're working with community radio, and what we found is parents are getting more engaged in their children's education. And of course, the ultimate is those parents themselves get some support to become literate, to do their own education. And as I put in the chat box, we do that even in the UK, where I've sat with parents who themselves don't have an education, who feel really challenged to support their children, and actually demystifying maths or reading for them has a huge benefit for them and for their children. So I think these integrated approaches are really, really key. Thank you.
Thank you so much, Gwen. Jerry, one question was specific to you. So based on your the analysis of the cost of inaction, what solutions do you see?
That's obviously a very important question, and all the panelists have been doing our best to address parts of that question. I'm not sure I have any special insights. I think what I would like to say is elaborate a bit on what's the purpose of this cost of inaction tool. Some of the comments say, oh, we know it's very costly, why bother make new estimates? Costs tell us the solutions. And my reason, or our reason for developing this tool, is to give a tool not for people like people at this conference who are very plugged into the challenges and the difficulties faced by pre-primary age schooling, but for negotiations within governments and between governments and international organizations about priorities. And for example, prior to our work, there had been some work by some very good economists at the World Bank estimating the costs of COVID-19 in terms of school closures, but they focus on only primary and secondary school. They ignore entirely pre-primary school. Our estimates suggest that per year of schooling missed, the costs are even higher for primary school, a topic which was ignored entirely in that study. So I don't think I have special insights into what are the best policies, both during the pandemic and in the post-pandemic period. And I guess I'm an optimist. I think there is a post-pandemic period. Having another tool which enables people who believe, as I think most members of this group believe, that investments in children in early life are extraordinarily important. Having another tool to demonstrate that and to sort out among different types of investments is the purpose of this exercise. And of course, it can be adapted explicitly to particular country context.
Thank you so much, Jerry. So we have about 6 minutes left. I would like to turn to Nafisa to briefly address the question regarding reaching and protecting children with disabilities amid COVID, very briefly. And then I would like to come back to Zoila, especially on the question of reaching parents and prioritizing parents also as important players in ECD, and any final reflections. And then I will close. Nafisa?
Thank you. And I was, when it comes to reaching children with disabilities during the pandemic, it's been quite challenging, but there are always solutions. And I think a blended approach of using community assets, community workers, people trusted in the community, and mobile phone technology has been really great. I've seen great work done by ITA in Pakistan in having empowering young women to go out in the community using social distancing strategies to find children with disabilities and support their families. And radio has been used extremely well in South Sudan also to reach out to parents and also help other parents who might not know that their child has a more invisible disability to identify when there are developmental delays. So I think there are really some positives around COVID, because I think there's been a lot more access to information more than before. And I think that I'm hoping that we will build back better and find even more innovative solutions moving forward.
Thank you very much, Nafisa. And Zoila, for your brief remarks. If we have Zoila still connected, maybe. Zoila, are you still connected? If not, yeah, it doesn't look. So let me now thank the panelists. This has been truly a fantastic series of presentations, insights, and discussion. Very rich in terms of evidence, in terms of insights from the ground, and also in terms of strategies and thinking how to make the case and how to advance the programs and investments in young children. I would like perhaps to highlight 4 takeaways. It has been very clear from what we have heard that there is a strong case to prioritize investments in young children, and that this case is now stronger than ever in the context of the pandemic, and even in the context of the fiscal pressures and limited fiscal space. So prioritizing young children is really key. Second, that we, meaning governments, development partners, civil society, need to act urgently and need to act creatively. The cost of inaction is huge, and there are solutions, there are interventions that can happen and that are happening even now, even in the context of the lockdown, and we need to bring these to scale. Third, we need to work together. It's clear that there is a lot of great work happening. There are a lot of great programs implemented by governments and through different players in the civil society and among development partners. But we need to work together. We need to work across sectors so as to address the needs of the children holistically, and make sure that there are no gaps and no child is left behind. And finally, there was also very good illustration of the importance of not only work now urgently, but also work strategically to build back better, to work towards strengthening the essential service delivery systems, making these more resilient, making these more inclusive for the future, and ensure continuity and quality of essential services in the future. So with this, let me thank again our panelists. Let me thank ECDAN, and especially Elizabeth as ECDAN Executive Director, for bringing us together and for working very hard to provide a platform for us to work together on the way forward. So thank you very much. Have a great day, and looking forward to seeing you and working with you on the way forward. Thank you.